Hi guys, it's Mr. Herring, and I'm going to be lecturing today on this next video on 1.2, which is the anatomical terms. And there's a lot of anatomical terms that we're going to learn. So not only are you going to see me talk about them a little bit, but you're going to also be practicing them today in class. Okay, so I'm sharing my video, um, and you guys can see this guy sitting there, and his palms are facing you, and his feet are straight at you, and his head is up and he's looking at you. And this is called anatomical position. Anatomical position is this exact position. The palms are towards you, the toes are facing you, his eyes are looking at you, and his head is up. So we think of this because we're going to learn about cuts or planes to the body, and we have to understand what anatomical position is. Okay, so now when we have someone standing, all these are pictures of anatomical position, and here is a girl, and she is facing sideways. We know that anything pointing towards the front is called the ventral or the anterior, and then anything towards the back is the posterior dorsal. Anything going towards the head is superior, and anything going towards the feet is inferior. So you might want to say, like, the head is superior to the shoulders, or you could say the waist is inferior to the shoulders. So it's kind of always has to be in relation to something else. If a structure or something we're talking about is more towards the middle of the body or towards the outside, if it's towards the middle, it's called medial. And if it's to the outside, it's called lateral. I like to think of like the lats when you guys are working your lats, your latissimus dorsi, they're on the outside. Okay, these here, the arms and the legs are the appendages, and the body is called the axial part of the body. And anything closer to the origin where the appendage comes out, so the closer you are to the shoulder or the closer you are to the hip, is called proximal, and the farther away you are from the connection of the appendage to the body, it's distal. So you might want to say, like, the elbow is more proximal than the hand, or you might want to say the wrist is more distal than the shoulder, so it's farther away from the point of connection. Finally, the last two anatomical positions that were on directional terms is if it's on the outside of the skin, that's called superficial, and if it's on inside, deep inside the body, it's called deep. Kind of like I told you earlier, this is the axial part of the body, and this is the appendicular or the appendage part of the body. This is where we'd use the distal and proximal. Here are all the anatomical terms. You guys can see that there's quite a few of anatomical terms. We are going to start learning them in class and doing kind of like a Simon Says, but right now I'm just kind of showing you them, and we'll work on them in a little bit. Some of them, like oral, we know is mouth, nasal is nose, frontal is forehead. You guys can make the connection. But other ones like antebrachial, that's the forearm. It's going to take a little bit of memorization. Okay, finally, the last part of this section are planes. You can see that we need to know what a view looks like, and there's three different planes or cuts. And so you look here, this is a cut that's straight up and down, and that's called the sagittal plane. So if you were looking at like an X-ray or a CT scan, and you would need to know, oh, it's cut like that, sagittally. From front to back, or anterior to posterior, is called the frontal plane. So this is kind of looking at the chest, the respiratory and circulatory system. And then if you're cutting and slicing from inferior to superior, that's called the transverse plane. Okay, so these just kind of shows you that those are those three planes. So today we talked about the different planes: sagittal, frontal, transverse. I introduced you and just showed you, we're going to be learning these today. Talked about axial and appendicular, the different directional terms, and what they all mean. Okay, that's it for today's lecture.